Hi, this is Dr. Christopher Maloney talking to you about yeast infections. As a naturopathic doctor, yeast infections are something that I see a lot. They're something that was very popular in the 80s. We still see that kind of coming along. They're not as hot as Lyme is or a number of other things right now. But we're still seeing a large number of people who have Candida infections. I really want to say right now that most of the people who think they have Candida may not have Candida. They might have some kind of bacterial imbalance in their guts, or they might have some kind of fungal infection or even another yeast infection. But to say you have one species, unless you're actually experiencing the topical and the surface mucosal problems with that species, Candida has a very specific look. And a lot of the problems that I see are systemic problems, but they don't necessarily correlate to that species as the problem. That said, the idea on the diagnosis of Candida is often the most kind of accurate thing that one could experience if you were, just reading a bunch of books from the 80s and saying, what do I have? What am I experiencing here? And I much prefer, I'll be honest, I much prefer the diagnosis of Candida to chronic Lyme, because chronic Lyme at this point has got such an expansive range of symptoms and then also testing that I much prefer that systemic diagnosis over the other. But for most of you, you probably don't have Candida. You probably have something that's going wrong in your gut, and you need to be corrected, and you need to do a lot of the steps that you would need to treat Candida. The detoxification of your body, the looking at your environment, the looking at your lifestyle, the processing and the modification of your food. The treatments are all the same or are similar, whether you have Candida or another bacteria that's overgrowing. But the fixation or the focus on that species is not necessary. It's mostly, if that's what gets you to come into the office and you start treating and thinking about what else is going on in your system, that's a really good choice. And for those of you who actually do have Candida, right here on the website I have the answer for you. It's a great thing. I much prefer it over the draconian diet stuff and everything that people are doing. I much prefer this as a model. You can read the research and look at it yourselves.